Good afternoon once more. I'm Vincent Obita. I'm going to show you how to do a catheter removal for the OSCE skill. It's also another 12-minute station for demonstration of the entire skill. So welcome. For this case, you enter the room, check for scene safety. My scene is safe to approach. Proceed, do hand hygiene using the rub. Through the 7 steps of hand hygiene by WHO. Then I proceed to my patient. Hello.
Hello.
Yes, I'm Vincent Obita. I'm the nurse going to take care of you today. Can I please confirm with you a few details?
Okay.
Kindly your full name.
Sally Bloom.
Sally Bloom, and your date of birth?
4/4/1940.
Okay, thank you. Would you mind I check with your wristband?
Sure.
Okay, you have Sally Bloom. Date of birth 04/04/1940, hospital number 123, 45B. So I have the right patient. Thank you. How may I call you?
Sally.
Okay, that's very much okay. So Sally, do you have any allergies to any medications?
No allergies.
Okay. And are you in any pain right now?
No pain.
Okay, thank you. I'm happy to hear that you're comfortable. Now, Sally, I'm here to remove the catheter that you're having. That's according to doctor's prescription, okay?
Okay.
Because it has assisted you, and again, prolonged use of the catheter predisposes you to infection. Is that okay?
Okay.
When we remove the catheter, you might encounter symptoms such as urinary frequency, agency, and some slight discomfort, but those will wear off within a short period. Is that okay with you?
Alright.
Okay, I'll prepare my equipment, then come back. In case you need me, just use this call bell and I'll attend to you. Is that okay?
Okay, thank you.
Okay, I'll do the hand hygiene. Proceed to the preparation area. In the preparation area, I'll do a full hand wash. Open the tap. Wet my hands. Put sufficient amount of soap. Do palm to palm. Palm over dorsum, fingers interlace, fingers interlock, tip rotation, thumb rotation, wrist rotation. I rinse my hands. Then using the elbow, I close the tap. And using the paper towels, I dry my hands to the general waist, my hands from top to bottom to the general waist. Then I put on the apron. Okay, Ancestor, is my trolley and tray clean and ready for use?
Yes.
Okay, thank you. Okay, so for this case, I'll require a garlic pot. I'll also require a clean pair of a sterile gauze, and I have here a sterile gauze. It is intact. Expiry date 2023. I'm happy to use. I'll also require 2 pair of gloves. I'll require a saline sachet, and here I have saline sachet. It is intact. Expiry date 2023 January, and no precipitate. I'm happy to use. I'll require a 10 ml syringe because according to the patient's prescription, the catheter was inflated with 10 ml of water for injection. So I'll require a 10 ml syringe, and expiry date 2023. It is intact. I will also require a chlorhexidine wipe. It is intact. Expiry date 2023. I'm happy to use. I will also require a hand gel. It is clear, no precipitate. Expiry date 2023. I'm happy to use. With that one, I'm happy to proceed to the patient. I do hand hygiene and proceed to the patient. Sally, how are you?
Okay.
Yes, I'm back. Are you happy we proceed with the procedure?
Yeah, sure.
Okay, thank you so much. So I provide privacy for the patient by drawing the curtains. Sally, I'll expose you a bit. Is that okay?
Okay.
Okay, that's fine. Assessor, I'm also checking the urine bag. It has no urine, otherwise I would have emptied prior to the procedure. So Sally, I'll request you to bend your knees and also pat your legs so that I'm able to visualize the perineal area, and I'll expose you slightly. Okay, thank you so much. So Assessor, I'm visualizing the perineal area. There is no discharge. There's no false odor coming from the area, so I'll go ahead and remove the catheter, then clean. Otherwise, I would have cleaned it first before the removal. So I'll open the syringe, discard in the clinical waste. Then from the portion through which the inflation was done, I go in with the syringe and remove 10 mils of water. Assessor, can you confirm I have 10 mils of water?
Yes.
Okay, thank you. I discard it in the clinical waste. Then now, Sally, I'll request you to breathe in and out. Kindly breathe for me. In and out. And Assessor, during that period, I'll apply firm continuous traction and remove the catheter gently. Okay, Sally, breathe in, breathe out, breathe in, and during breathing out, I remove the catheter, and the catheter is out, Sally. Assessor, I'm checking for the tip of the catheter. No bleeding, no discharge, so I'm happy to note that there is no sign of infection. Otherwise, I would have sent the tip to the lab for further analysis. I discard this in the clinical waste bin. Remove gloves to the clinical waste bin. Do my hand hygiene. So Sally, I'm going to clean your private area, don't worry, so that you become comfortable. Is that okay with you?
Okay.
Okay, thank you so much. Okay, then I'm going to clean the normal saline sachet for 30 seconds. Now Sally, after the removal of the catheter, you need to take note of symptoms such as pain from your abdomen, okay? Also pain while passing your urine and any discharge coming from the urethra. Is that okay?
Okay.
Kindly. And again, the 30 seconds are over. Again, Sally, you can prevent the urinary tract infection by ensuring you do some exercise. Is that okay? By walking around if you are capable. At the same time, take sufficient amount of liquid, of water, that is 6 to 8 glasses, that will enable you to flush all that you have in your bladder constantly. You also need to maintain hygiene. Always wipe yourself from front to back so that you maintain personal hygiene and prevent any infection. The 30 seconds are over. I open the saline, pour it on the galley pot, discard in the clinical waste. I'll slightly open the gauzes. I'll open the gauzes, then do hand hygiene. I'll put on the second pair of gloves. Okay, now Assessor, I'll use this hand as my clean hand and this as my working hand. Pick one gauze, dip it in saline, remove excess saline, drop it on the working hand, clean the farthest labia from front to back in a single stroke, discard in the clinical waste. Pick the second gauze in saline, squeeze it, drop it in the working hand, clean the nearest portion of the labia to the clinical waste. Pick the third gauze in saline, squeeze it, drop it to the working hand, clean the middle portion of the perineum to the clinical waste. Then with my clean hand, I cover the patient. Now, Sally, how are you feeling?
Good.
Yes, kindly now you can stretch your legs and assume a comfortable position. Are you comfortable?
Yes, I'm fine.
Okay, thank you so much. Now we are done and I'm happy. Is that okay?
Okay.
Okay, so I'll return all my equipment, then come back in case you need me. Just press the call bell. Is that okay?
Alright.
Okay, thank you so much. I proceed to my preparation area. Discard all the remaining materials to the clinical waste bin. Rip off my apron. Remove the gloves. I'll do hand hygiene. Assessor, I'll document in Sally's notes that the catheter has been removed and no sign of infection noted either from the perineum or from the catheter tip. So we continue monitoring Sally for any sign of tract infection. I then proceed to the patient. Now, Sally, how are you feeling right now?
I'm good.
Okay, that's very fine. Now, you need to take note that when you feel like going to the washroom, kindly inform me so that I can measure the first portion of the urine. Okay, that will help in determining if you have any urinary retention. Remember, after having the catheter, your bladder might feel a bit lazy. Is that okay?
Okay.
Okay, but you can also prevent that by doing some exercise and taking sufficient amount of water, as we had talked earlier. Is that okay with you?
Yeah.
Do you have any question?
No, it's not.
Okay, thank you so much and bye.
Thank you.
Okay.